Statins. Chances are you've heard of them. They're one of the most common prescriptions on the entire planet, and they help millions of people lower their cholesterol and prevent things like heart attacks. But there's a flip side, right? A long list of potential side effects that can sound, frankly, pretty terrifying. So how do we separate what's real from what's just noise? Well, today we're going to dive deep into the absolute highest quality science to get to the bottom of it. Let's go.
So take this story. This is from a reader named CCEA, and she's talking about her mother. She noticed her mom's cognition just started to decline right after her statin dose was increased. It's a scary situation. And it perfectly captures that feeling of anxiety so many people have when a loved one starts a new, powerful drug.
And that brings us to the big question, doesn't it? Are fears like Cece's, especially around something as precious as memory, actually supported by solid, rigorous evidence? Or is there maybe something else going on here? That's what we're here to find out.
Look, Cece's story isn't some rare outlier. This fear is deeply personal, and it is incredibly common. It can be the deciding factor in whether someone sticks with a treatment that could literally save their life. So understanding this is absolutely crucial.
So you have to ask, where does all this confusion and anxiety even come from? Well, a big piece of the puzzle is how medical information gets presented to us in the first place.
I mean, think about it. Have you ever actually unfolded that giant tissue-thin leaflet inside a box of medicine? It can feel like you're reading a laundry list of every terrible thing that could possibly happen to a person. It lists dozens of symptoms, but what it doesn't do a great job of is telling you what's common, what's super rare, or, and this is the key part, what has simply been reported by someone versus what's been proven to be caused by the drug.
And this gets to the very heart of critical thinking. See, not all evidence is created equal. Reports from patients are what we call observational data. They can show a correlation, meaning two things happened around the same time, but they can't prove that one thing caused the other. For that, you need the gold standard of medical evidence, a large-scale, randomized controlled trial. That's where one group gets the drug, another gets a sugar pill, and nobody, not the patients, not even the doctors, knows who got what until the end. It is the absolute best way we have to remove bias and find out if the drug is the true cause of a side effect.
So to finally put this debate to rest, the scientific community decided to go big. A huge international team of experts got together to pool all the best evidence they could find to get a single definitive answer.
And the tool they used is something called a meta-analysis. Now, you can think of this as a study of studies. Instead of just relying on one experiment, a meta-analysis scoops up the data from many of those gold standard trials and combines it all. This gives the final result incredible statistical power. It's the difference between one detective looking at a clue and a whole room of detectives pooling all their evidence.
And the results of this massive undertaking were published in one of the most respected medical journals in the entire world, The Lancet. So we're not talking about just another opinion here. This is top-tier, heavily scrutinized science.
First, just get a sense of the sheer scale we're talking about. The researchers analyzed data from nearly 124,000 people. I mean, that is an enormous sample size, which gives their conclusions incredible weight.
And it wasn't just any data. This was pulled from 19 of those gold standard randomized trials we just talked about. This is all about the quality of the evidence, not just the quantity.
The whole thing was done by a group called the Cholesterol Treatment Trialists Collaboration. That's a team of 150 experts from all over the globe, basically a global consensus of the people who know this stuff best. So, after all of that, what did they actually find? Okay, let's get to the verdict. We'll start with the side effects that the evidence confirmed are, in fact, directly caused by statins. So the analysis nailed down two main things. First, muscle issues. They are real, but they are very rare. We are talking about maybe one case for every 10,000 people taking the drug for a full year. Second, there was a small increase in new diabetes diagnoses, but this was seen almost entirely in people whose blood sugar was already in that borderline pre-diabetic range before they ever took a single pill.
All right, now for the main event. What about all those other fears, the ones that keep people up at night and create so much anxiety for patients like CCA's mother?
Well, the results were about as clear as they could possibly be. After sifting through all that data from over 120,000 people, the researchers found no causal link between statins and a whole host of feared side effects. This includes cognitive decline and memory loss. It includes depression. It includes sleep disorders. For the vast majority of those things you see listed on those scary-looking labels, the highest quality evidence we have just doesn't show a direct connection.
So what do we do with this? Why is a finding like this so incredibly important for patients and for doctors everywhere? Well, this is where context becomes everything. You can't just look at risk in a vacuum. You have to weigh it against the benefit. And that same mountain of evidence shows that for patients who already have heart disease, a 5-year course of statins can prevent a heart attack or stroke in about 1 out of every 10 people. Even for those who are just at high risk, it still lowers their chances by about 5%. These are huge, life-saving numbers.
And because those benefits are so clear, and so many of the feared side effects just aren't backed up by the evidence, the authors of the study made a very direct call to action. They argue that the drug labels themselves and all the official health information need to be updated to reflect what the best science actually says.
And the goal here is simple, but it's really powerful. It's to cut through the confusion. The whole point is to empower you and your doctor with the most accurate information out there so that you can work together and make the best decision for you, based on facts, not fear.
So that leaves us with one last crucial question to think about. When we finally manage to separate fact from fear, we have to look at the risk differently. What's actually the bigger danger? The proven but very rare side effects of a life-saving medication? Or the devastating and far more common effects of the disease it's designed to prevent? It's a question worth asking.